Scripps has put together a team of experts that will look at all the vaccines being developed from around the world to help them decide which one they will actually offer their patients and staff. They're going to have their first meeting on Friday. They tell us that safety and scientific data is their guide, not speed.
Most physicians are skeptical as well, and I think that's good because the science teaches them to look at the data and be a little bit skeptical because, the first rule is do no harm.
As President Trump continues to promise a fast-tracked COVID-19 vaccine at no cost for all, Scripps Health here in San Diego promises a more methodical approach, assembling a consortium of experts to analyze and choose the best vaccine out of hundreds being developed around the world.
We're going to look at all of them. Certainly those that are in phase 3 trials will be the first ones we'll take a look at, but we fully anticipate that some of the others will ultimately go to phase 3 trials.
Chris Van Gorder is the CEO of Scripps Health. Ultimately, he's the one who'll make the final choice. He says at this point it's impossible to offer a timetable. No vaccine is FDA approved. However, during the president's town hall Tuesday, he hinted a vaccine could be coming before the election. Most experts agree a widely available vaccine won't be ready before the end of the year or early 2021. And that's including the Federal Department of Health and Human Services, which outlined a plan to Congress Wednesday offering free vaccine distribution.
I just read this morning that there may be one that's available in November. It would be small scale. It would not be something that would be able to be distributed widely anyway.
Andy points out even if a vaccine is available January, February, it'll still be quite a while before everyone is fully vaccinated.
It'll probably take a good 6 months to a year to even vaccinate just our country, much less the world. So it's going to be a little bit of time. There's not going to be a vaccine out and everything goes back to normal in a matter of weeks. It'll be months before everything get back to what we all would like to see as normal.
And even with that, there's still the matter of convincing the general population to get vaccinated in the first place.
Perception is very important. And first of all, that's the reason we want to base our decisions based on science and medicine, not speculation, not politics. I'm going to be probably first in line. I do trust our doctors, and I trust our scientists, and I know they're going to go through great due diligence before they would recommend it to their patients. And I'm just one of their patients.
So again, the Scripps COVID-19 committee will have their first meeting on Friday. They promise to be transparent and share all of the information that they learn. Clearly, though, any firm choice is a ways away, but we will continue to follow it. From La Jolla, Misha DeBono, Fox 5 News.